Welcome to Community Tomorrow. My name's John Goliatuna. I'm your host. This evening, we're changing gears again. We're going to be talking about health. And with me this evening is Edward Markowitz, who's a doctor of chiropractic with the Physician Health and Injury Center. And we got Carla Allstraner, who's got an MS degree in nutrition. And we're going to be talking about those two areas, and I want to welcome you to the show.
Thank you, John.
Okay.
Thank you. Thank
All right,
you.
you're welcome.
Nice to see you.
Okay.
Thank you.
You're welcome. Before we start, if you can tell us a little bit about your background, how you got to your current position, you know, your educational background and family, or whatever you'd like to share with us.
Sure. I'm a chiropractic physician. I've been practicing in the greater Danbury area for almost 30 years. I graduated from Northwestern College of Chiropractic with honors. I've been the clinical director of a facility called Physicians Health and Injury Center. It's actually a wellness center, a multidisciplinary wellness center in Danbury. I've also been very involved with natural health care for 30 years, and I would say that I've been on the Danbury Hospital Surgery Committee. I've also been a member of the Foundation of Wellness Professionals, and I've lectured on a lot of different topics related to natural health care and natural solutions to various health problems for the last 30 years, too. I've treated over 10,000 people in the greater Danbury area, specializing in neuromuscular conditions and natural health care.
Been busy.
Been busy.
That's good. And Carla?
I've been a nutritionist within the area and working with Ed Markowitz for at least 26 years. But my background is I have an undergraduate degree in biochemistry and nutrition from the Evergreen State College in Olympia, Washington, and then a graduate degree from the University of Bridgeport in Bridgeport, Connecticut. So, and that's in, again, nutrition and biochem.
Okay. Okay, very good. Can you tell us a little bit about your team approach, Dr. Markowitz?
Yeah. Ever since beginning practice, I felt that I wanted to try and help as many people as possible with a natural approach to health care. And our practice was really the first one in the state of Connecticut to have therapeutic massage and clinical nutrition as part of our practice. Chiropractic, nutrition, and massage were the first team members, and Carla was our first nutritionist about 27 or 28 years ago. We then we've added several other specialties and disciplines since then. We've had medical doctors in our facility for about the last 15 years. I also practice acupuncture without needles is another specialty we have in the office. We have
without needles.
Without needles, yeah.
Oh, okay.
I'll tell you a little bit more about that. And we have
it doesn't hurt as much.
It doesn't hurt at all. And we've also had physical therapy in our office for about the last 15 years. We also do personal training that's specialized in getting people who are injured back to exercise and people who want to lose weight into exercise. And that's why we feel we have a team approach. And I ask people a lot of times, you know, if they've been to a medical doctor, or if they've been to a chiropractor, or if they've been to a physical therapist, or if they've been to a nutritionist. And people will raise their hands if I'm talking to an audience, and they'll say, yes, I've been to each one of those. But then when I ask them if they've been to a place that has all of those in one facility or under one roof, I rarely get a hand up. And so that's why I think we have a unique multidisciplinary team approach to health care. It's in one place. We talk to each other about patients and about what we're each doing. It's not like a person has to go to several facilities. You know, if I'm going to send somebody to Carla for some nutritional counseling or some of the specialized work she does with allergies, I'm going to tell her a little bit about the patient. We talk before she actually sees the patient. We talk afterwards. We discuss what we're each doing. And it really allows for a team approach, a true team approach where people who are working on someone, at least they know that their clinicians and their doctors are talking together and consulting. Another advantage of it is that people don't have to pay 5 different co-pays if they go to several different doctors and chiropractors and physical therapists. It's all in one facility.
That's a good point today, yeah. I'm going to go a little bit back and forth.
Sure.
Carla, how long have you been practicing the, is it the
NAET?
Yeah, NAET. Yeah, I should have spelled that.
NAET stands for the woman who founded it, which is Dr. Devi Namboodiripad,
Right.
which is a mouthful. And it's Namboodiripad allergy elimination technique, and I've been practicing it for 15 years within the area. I was one of the first, actually, absolutely one of the first in this whole area that ever started, and it was a new science. Now there are more people that I understand in Westchester and even in Connecticut that are using it, because Dr. Devi is in California, which all the new ideas of prevention and healthcare usually starts.
Yeah, that's for all the waves, even in legal waves. The new waves come across, well, I guess like the ocean or whatever, but it seems to be that California is where all these new ideas come from.
Yes, and she is absolutely amazing. She's just such a pioneer, and has made this, her whole thrust in the NAET program or methodology was to just help people and help eliminate people with their sensitivities and allergies. And that was in her teaching, and she's really passed it on to all of us that have followed her. So it's a wonderful approach to eliminate sensitivities and allergies.
And in full disclosure to the audience out there, I want to indicate that I have been treated by Dr. Carla here, and that does work.
Thanks.
Yes. What kind of allergies and sensitivities does this technique address?
Both environmental and food, and trees, pollens, grasses, ragweeds, also lactose intolerances, and as you know, and tomatoes or wheat. It really has a far-reaching application to all kinds of sensitivities. Even people, what can happen is you might have a slight sensitivity to something, and it's compounded by other allergies. So you start eliminating sensitivities, and you don't even realize that all of a sudden you feel so much better. But it's as you eliminate each one, you're lessening the compounding of 2, 3, 4 allergens.
Right, which causes the eventual breakdown.
Yeah, you could be tired, you could have red eyes, itchy eyes, you could have all kinds of symptoms. Nobody has the same symptoms.
Okay, and we'll switch over here. Where do you patients come from? Do they come from all over? Are they referred to you by people, medical doctors also, in addition to past patients?
Yeah, the major source of referrals are other patients.
Right.
Their families, friends, spouses, people they know. We also get referrals from doctors, other physicians in the area. For example, obstetricians and gynecologists will send us many pregnant ladies who really can't have any medication during pregnancy for their back pain problems. We get people from other specialties also, psychiatrists and psychotherapists also for stress-related problems and how that affects physical problems. We get referrals from orthopedists and neurologists and neurosurgeons. So doctors are a big source of referral. We see a lot of people from who've been involved in car accidents. Sometimes we'll get referrals from their attorneys because they know we've been doing that for about 30 years, and I've testified on many cases as an expert witness. And then we also, I personally and some staff that I have, we do a lot of community education also. I do some lecturing on a variety of different topics, from back safety to natural approaches to allergies and digestion and female hormonal problems and stress, and so those workshops attract people. And then we
you do workshops.
We do a workshop, educational workshop, and those are some of the sources of our patients also. And then I would say sometimes we do health screenings in the community. We do screenings on osteoporosis and screenings on pain and stress in the community also, and many times people have problems that haven't been solved elsewhere. elsewhere, and we'll wind up saying, boy, that sounds like an interesting place to go to, and maybe I'll give it a try.
Now, do you have a website where you may have your upcoming workshops listed for viewers?
Yes, we do. Actually, there's a website. It's physicianshealth.net with no space. And,
right.
The next workshop is actually tomorrow night.
Well,
and also Thursday night on solving female hormonal problems naturally.
Do you tend to have them on Tuesdays and Thursdays?
Usually Tuesdays and Thursdays,
right.
And usually there are a couple of topics each month.
But they're listed on the website?
They're listed on the website, and they're usually presented at the Ethan Allen
Oh, okay. So you don't have them on premise. Okay.
Not on the premises, yeah.
Well, you need a classroom.
We need a little space, yeah.
Okay. Carla, let's continue with your success rate. What's your success rate been with the NAET? I won't even try to say it.
I would say, in all honesty, it would be between 87 and 88%. Now, that's not, I haven't done statistics and graphs, but just from feedback from patients, there have been a few times where things have had to be redone, and so...
but when you're almost at 90%,
yes, this is my own interpretation of what my patients have told me. It might even be a bit higher, but I have had amazing results.
You're almost pulling an A, or an A minus at least.
Oh, it's at least an A.
Okay, and well, obviously you enjoy the job you do, otherwise you wouldn't be doing it for all these years, right?
I love my job.
Yeah.
Each one of my patients becomes actually someone who I get to know, and the fact that they feel better is the most rewarding thing that a person can have within her job.
Yeah, when I look one of my allergies, she goes, yes.
I've known Carla for almost 30 years, and it's been a pleasure working with her, and I've seen some of the terrific results that she's been able to accomplish with people. It's pretty miraculous as far as allergies are concerned.
Right. Now, what type of conditions do you run into, you personally as a chiropractor? Do you treat younger kids also, or?
Yeah, I'd say the youngest person I've ever treated has been under a month old, and the oldest person has been in their 90s. So we're we're really primary care natural physicians, and we really have to be able to decide whether or not we can help someone, or we have to refer them out to another specialty. But age is not limited in our profession. We're trained in pediatrics and geriatrics. It's not our specialties, but it's really part of our practice. So age is not a limiting factor. Some infants can be traumatized right at birth and really need some chiropractic care immediately because of the trauma of birth sometimes, and some of the things that get passed on from their mothers. And geriatrics really, really need what we do very much so also, because they really, really have only a medication as an alternative many times, and many people at a certain age are on so many multiple medication. It's always nice to find an alternative, and there really are many alternatives.
Because the medications work maybe for a while, but over time they do deplete the body.
Ideally, you want to try and help the person become healthier, and if it's possible, in our mission statement, what we say is limit the need for medication and surgery. It doesn't say eliminate it, and we do have medical doctors who work in our office. So we just like to limit it. If we can cut somebody's medication in half, or we can give them an alternative to it and still get the same results, I think I've done a lot for the patient. I used to have a medical doctor who worked with me for several years, and one day he just stopped me in the hallway and he said, "Ed, I've been here for a couple of years," and he used to work in a very traditional internal medicine practice with 10 other interns. He said, "Ed, since I've been working here in this team approach to healthcare, I prescribe 1/10 of the medication that I used to prescribe for the same conditions." And then and this was an unsolicited statement by a very traditional doctor who just started to work in this field, and he liked it so much he actually opened his own integrated center in southern Connecticut. So he's no longer with me, surgery, but he really appreciated the fact that there are alternatives to medication and surgery many times.
And that's the ultimate form of compliment when someone opens something that's similar.
I think so.
And he located somewhere else.
He
So it didn't hurt
somewhere else, but he opened another place very similar.
Yeah, that's a good point. So you mainly deal with chiropractic situations, right?
Well, chiropractic also is not just neck and back pain. It really is affecting, it really has an effect on the nervous system, which is really the system that controls all the functions of your body. So many times when people might have a back problem, those same nerves that are giving someone back pain also carry messages of function to your lower gastrointestinal areas and to your genitourinary area. So many times when we're also fixing someone's back pain, we're taking pressure off the nerves which control those problems, which control those areas, and we'll get people who say, oh boy, my digestion is better, I'm not constipated, or I don't have urgency going to the bathroom. I've had kids who we help with bedwetting. So if the nerves are really part of the problem, then we can help it. If that's really the area that is really causing the problem, then that's something we can help. If it's gotten too far, if there's a pathology there, that's not something that we can help. Many times there's really a big effect on the function of your body by what chiropractors do also, not just pain.
All right, and then there's people that they think, well, once you start going, you have to go every week or whatever. It could be a maintenance thing, could be like twice a month or even once a month. If you need it a second time, and you're in maintenance, after you've taken care of the problem. But it's good to have some type of maintenance up once you've taken care of that problem, whatever that acute problem was, pulling something out of the back of your car and is going ow, ow, ow all the way down your leg or whatever, and then it's
maintenance might be necessary. I think so. We never force anyone to have maintenance. They choose it on their own. But name something that doesn't need maintenance. Cars need maintenance, houses need maintenance, people need maintenance.
Right.
And so let's say if someone's on pain medication, they stop taking it, their pain is going to come back. If people stop doing what helped them, there's a tendency for their problems to return. So if chiropractic helped them, or exercise helped them, or a change in diet or nutrition helped them, if they don't keep doing that, or they don't really get advice about how to continue to do that, their problems will return. So it's not really a negative thing that people need what we do. When someone's put on blood pressure medication, they're not told to just take it for a month, they're told to take it for life. And so again, it's an option for people, and usually a wise option. It prevents the emergencies, where I don't see people who I used, maybe crawled in when they first came into the office.
Right.
If they follow some sort of a maintenance program, they don't wind up getting that bad again for the most part. They never get that bad again. Very rare, let's put it that way. It's very rare, much minimized, and we usually get them better faster if they follow some sort of a maintenance program also. So, but it's always their option.
Is there some type of maintenance with diets? When somebody has come to you, let's say, and lost 30 pounds and they seem to be fine, do you recommend like once a year come back and
yes, usually
make sure they're not falling into bad habits again? Because then, especially when they're starting to creep back up in weight, then you know that they're starting to go back in the same direction that they were before.
Usually patients will come if they're done and they leave and they're in good health. I usually will see them probably twice a year. They do come back. There's always something that needs to be a little tweaked, or they need a little help making decisions. And also the nutrition field changes all the time. So if I have them on some supplements, there might be something better, or I can manipulate things a little bit better for them so that they don't have to take as much any longer, or there's something that just makes them feel better, or they can cut down on things because they've been following their diets for so long and exercise routines and everything else. So yeah, usually people, if they're done, they're in perfect condition when they leave, they come in once, twice a year. It's always nice to see them too.
That's true. Now, part of chiropractic, you have the maintenance, but then there's always a recommendation. There's always seems to be that you should do something in between, and most people don't realize it, but they really should have some type of maybe a massage once a month or whatever. You know, in other words, at the beginning of the month you go for your chiropractic maintenance, then maybe at the 2 weeks later, instead of going a second time, you do that also.
Yeah, we try to combine whatever is going to be helpful for the patient. Massage is one of the things that I found very, very helpful. I almost take the care that I perform on patients in phases. The first thing, if they're in pain, is really to relieve their pain. That's phase one.
Right.
Phase two might be strengthening and conditioning an area so it doesn't tend to come back. And phase three would be something like maintenance. And in phase one and two, massage could be something that we do. Physical therapy could be something that we do. Exercise and strengthening could be something we do. Nutrition could be something that we do. And then I would say the maintenance part, it varies depending upon the person. Some people don't want it. Some people realize that it's important, and it depends on their stress in their life also. So some people have got very, very stressful lives. Physically stressful, mentally stressful, chemically stressful. If their lives are more stressful, they need more maintenance. If their lives are less stressful, then I find that they need less. If they've already had damage to their spine, they may need more maintenance. People who sit all the time have more stress on their spines than people who have standing occupations.
Especially in a steel chair.
Especially in a steel chair. Especially, you know, people who drive all the time. So it really depends a little bit. And I try to actually stretch out how much they can go without care, actually. And we test it out. We say, you know, let's see how a month does. Let's see how a couple of months. Let's see how 2 months does. Let's stretch it out a little bit and see if none of your symptoms return and you still check out okay. So we try to stretch it out as much as we can, but it varies.
Some people can go a little longer than a month.
Some people can go longer, sure.
But a month is about.
Yeah, for many people it is, but some people it's really, you know, less than that. Some people maybe more.
You have a trainer on staff there for people that want to take advantage of, let's say, build up that area. Yeah. It might be your lower back that's causing the problem, and and you're when you adjust them, let's say that area it goes into balance. But if they built up the muscle around that area, that would help keep it in.
Building up the area is very important. Teaching people how to loosen up area is important. Also stretching. And the third thing that's very important that our trainer, it's not really the same as someone who only works at a gym, although that's where some of her training is from, is really she was a master trainer at a sports club. But she also had specialized training in working with injured people and people who haven't exercised for a while. And she really teaches people how to go through their daily routine without hurting themselves. It's amazing how many people don't have to lift trucks to hurt themselves. They just bend over the wrong way, or they do it repeatedly, or they sit the wrong way. So the ergonomics of doing things properly is very important, or teaching people how to sit, stand, sleep, bend, lift. All of that is something that she teaches our patients too. So it's really like a back education class that they go through with her also, depending upon their problem. A spinal education class.
Now getting back to diets, or that entire area, is there anything that is more prominent than another? In other words, people wanting to lose weight, is that over people that have problems with ragweed and allergies, or what do you?
Well, to be honest with you, John, most people do not want to change their diets. If I gave you this statistic that say 87 to 88% of people get better. My statistic as far as people who come in and they actually want to do the work to change their diet is maybe 30%.
Oh, really?
It's, I'm sorry to say that. I wish
they just want you to take out a wand and go and get rid of it.
I think, what really will make someone want to change is extremely poor health, and they have to, or they're just completely disgusted with themselves and then they say, okay, that's it. But for the most part, there are a lot of reasons why people stay with the diets that they have. It has to do with their culture, it has to do with habits, it has to do with socializing. There's so many areas. I try to...
Well, actually, that's the direction I wanted to go, is that you said to me, for example, people from Southern Europe, they tend to have a certain diet that's different than, let's say, if you're a Dane or you're a Norwegian.
Absolutely.
So that, what you prescribe is different, but that's because they're from two parts of a different, same continent. you know, the Northern European versus the Southern European, where the Southern European might eat pastas and can't get away from pastas, so you say, well, let's work around it, let's not eat hamburgers, or whatever. And that might work for that person, where the Norwegian, you can't take the meat away from them, you know, that kind of thing.
Actually,
right?
they eat more fish and...
oh, really? Okay.
They're in the Norwegian, or I'm sorry, in the Scandinavian countries, their biggest problem is salt, because they brine everything.
I see.
So they have problems with their teeth, their blood pressure, things like that. Whereas in the southern Mediterranean countries, actually their diet's pretty good. You know, they eat mostly fresh vegetables, fresh fruits, and so, you know, pasta balances out.
Yeah, the only fat Italians that I've seen in my lifetime are over here in the United States, because when I've gone over there, it's amazing how they all look normal. They look like they're all on diets.
Yeah.
They have a great way of fattening up just about any culture when they come over, come over here. It isn't just Italian.
We got the golden arches.
Yeah, if you don't see them in their native country, but when they get here, they change their diet enough to really, unfortunately, put on weight.
Yeah. Can you again share with us the website, and if you know, for informational purposes, you know, and again tell us about when the workshops are and all.
Yeah, the website is physicianshealth.net. The workshops are usually Tuesday and Thursday, twice a month. They'll be listed on the website at least one week or so before the workshop. And also, I just wanted to mention, you know, at every workshop or screening that we do, we give people an opportunity to come into our office. And I wanted to give people an opportunity that are watching here today. We actually give them a consultation and screening exam, and possibly a nutritional visit if that's also part of what they would like. But at that consultation and screening exam, we determine whether we're an office that might be able to help them. There's no charge, there's no obligation. It's really a comprehensive consultation and screening. It includes seeing how their nervous system is functioning, seeing if their adrenal glands are under a lot of stress, seeing that if those are symptoms.
They're sorry, but they're waving to me goodbye.
I really appreciate being here.
I want to thank you for coming on the show.
Thank you, John.
Yeah, you're welcome, and I want to thank the viewers for tuning in the Community Forum. Tune in next week, same time, same station. I'm sure we'll have another interesting program. Good night for now, and we'll see you then.